Hello guys, vanakkam and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and plus and OET training. Hope everyone is doing well. Successfully, most of the students has completed the NORCET-9 exams. So clearing the prelims exams, after that attempting the NORCET-9 mains exam, it's a great thing and now it is a time to wait for the result. So let's hope for the best. And for NORCET-10, most of the students were asking for the coaching classes when the classes is going to start. Dear students, already the demo classes is running on and till 30th the demo classes will be there, and if you want to take the admission, please take the admission as early as possible because only limited seats are there. And from next month onwards the regular classes for NORCET-10 is going to be start. So as early as possible get the admission. And so by seeing the visuals, you would have been known that what I'm going to discuss today. I'm going to discuss the NORCET-9 main question paper. So approximately 20 questions today we will discuss, and tomorrow again part 2 it will be released related to these questions. So let's begin the session without wasting the time. So let's start from the first one. So the first question is, if a patient had shock coupled rhythm. So always when you are reading the question, I used to say to the students, you have to find out the key point. If you know the key point, easily you can grasp the answer. So if you following this strategy, definitely it will be very easy for you to solve the question in very fast manner. So instead of wasting the time in reading the question again and again, just check for the key points. Okay, for example, in this question, if a patient had shock coupled rhythm, at what time should the nurse administer adrenaline? Two key points are there. First, they are said about shock coupled rhythm. So in two conditions, we are using the shock coupled rhythm. The first one is ventricular fibrillation, and the second one is pulseless ventricular tachycardia. We will be using the defibrillator shock coupled rhythm, right? So one time, two times, three times, we will be using the defibrillator shock coupled rhythm along with the CPR, right? Fine. So not only defibrillator, not only CPR is going to help the patient, and also we have to introduce some drugs along with the defibrillator, along with the CPR. We supposed to introduce some drugs, right? So at what time, at what cycle we supposed to introduce the adrenaline? This is the question. So two key points I have mentioned here. One is shockable rhythm, and second thing, what time the adrenaline has to be administered. So these two key points will make you or will take you to the answer. So what is the answer? See guys, actually the first drug of choice for the patient who is undergoing ACLS is amidrone. Okay, but that amidrone word is not mentioned here. Directly they have asked about the adrenaline. So usually adrenaline, two things are very important in the adrenaline. The first one is dosage, and second one is at what cycle we supposed to introduce the adrenaline. Understand my words very carefully. The first very important point related to adrenaline is dosage, and second one is at what cycle we supposed to introduce the adrenaline. So the answer is the dosage 1 mg IV we supposed to introduce to the patient during ACLS. And what cycle? At the second cycle, after the second cycle of defibrillator, you supposed to use the adrenaline. Supposed to use what? Adrenaline. Okay, so this is the exact answer. For example, you can see option B, 1 mg IV. After the third shock they have mentioned here. Okay, so third shock is very close to the second shock, right? Because second shock is not mentioned. See, this is the right dosage, 1 mg IV. After the third shock they have mentioned here, the right dosage is 1 mg. 1 mg is the right dosage. But if they are mentioning second shot, the answer is exactly correct. But they doesn't mention the second shock. 1 mg second shot they doesn't mention. 1 mg third shock they have mentioned. It is nearly close to the answer, right? So that's why we are going to select what? Option B as a correct one. So here the right answer is option B for this question, that is 1 mg IV after the third shock. Okay, and other options we can remove or eliminate. Why we supposed to eliminate? You can see here 10 mg IV. 10 mg IV of adrenaline, it is a huge dose. You should not give 10 mg. We have to give only 1 mg, right? So the right answer is option B, already we have discussed. And option C, 0.1 mg IV after second shock. 0.1 mg is very, very low dose. 10 mg is very high dose and 0.1 mg is very low dose. And 0.1 mg IV after the third shock, this is also wrong. Okay, so on the whole, the right answer is option B, that is 1 mg IV after third shot. Okay, fine. So the first question is over, and second one, Kawasaki disease primarily affect which type of the blood vessel? Direct question, repeatedly asked question. We doesn't expect that this kind of easy questions in NORCET mains exams. Usually we will be getting the scenario based paragraph type questions, but here most of the questions they have asked like this one only. Okay, so the second question, Kawasaki disease primarily affect which type of blood vessel? So this is the question. So Kawasaki disease means you already know that usually it affects the medium size arteries, especially the coronary artery. If you know this concept, it will take you directly to the option A, that is medium vessels. Okay, I have given the rationals also. Just pause the video and look at or read the rationals. Okay, for Kawasaki disease, the right answer is going to be medium vessels. That is, medium size arteries are most commonly affected, and especially coronary arteries are most commonly affected by the Kawasaki disease. The next one, a 30-year-old unconscious trauma patient. This is the first key point. Is brought to the emergency department. Despite performing the jot rest maneuver, they are performing the jot rest maneuver. Okay, they are doing the jot rest maneuver. Okay, he is unable to maintain the airway pattern. See, the first key point, unconscious trauma patient. Trauma is the key point. Second, they performing the jot rest maneuver. Third, unable to maintain the airway pattern. See, so what adjuvant? What airway adjuvant? This is the fourth key point. Airway adjuvant is used this time for opening the airway, for maintaining the patency of the airway. What instrument will help now? And here the right answer is endotracheal tube. Okay, so endotracheal tube will commonly used for the trauma unconscious patient whose airway patency is not at all maintained. The first option what we have to think is endotracheal tube. You can ask one question, sir, why not oropharyngeal airway, nasopharyngeal airway, laryngeal mask airway? Why not these options are correct? Here clearly I have given the rationale. You can see here oropharyngeal airway. There is a chance for aspiration. Okay, for trauma patient we should not use this. Second one, nasopharyngeal airway. Again, this cannot be used for trauma patient because if there is a basilar skull fracture, basilar skull fracture is very important question in head injury, right? See, raccoon eye, battle sign, halo sign, all these things are connected with the basilar skull fracture. So, if the doctor is suspecting basilar skull fracture, we should not use what? NPA, nasopharyngeal airway. And the last one is laryngeal mask airway. Here, it is not a best choice for trauma patient because it is done for the elective surgeries. It is used in the elective surgery. So, on the whole, the endotracheal tube is the best option for the unconscious trauma patient whose airway patency is not at all maintained. Okay, so these things will make you to select what option C, that is ET tube. Okay, the next question is question number 4. A trauma patient needs to be intubated and is being resuscitated in the emergency department. So, an intubation should be done and being resuscitated in the emergency department. Resuscitation means what? They have started with the medication and they have intubated also. They intubated the ET tube, started with the medication. Which of the following method is most appropriate to confirm the correct placement of the ET tube? This is the key point. Confirm the correct placement of the ET tube, what you are going to do, what you're supposed to do. So 4 options they have given here. Assess the lung sense. Yes, we will be doing the assessment in the lung sense. And also we used to take x-rays. But these things are not accurate method. They are asking the accurate method to confirm the ET tube placement. So assess the lung sound. It is not appropriate, but obviously we are doing that. End wave capnography. That is the right answer. Okay, I will be explaining about what is that. Direct visualization of the vocal cord. It's not an appropriate method, none of the above. So here I have given the rationale very clearly. The best and most accurate method to confirm the ET tube placement is end-tidal CO2 capnography, otherwise carbon dioxide capnography. In short, we can say it as end wave capnography. Okay, fine. So the normal value is 35 to 45 mm of mercury. There is a sensor attached in the ET tube. Okay, that sensor will be assessing the end capnography, carbon dioxide capnography. See, exactly the end carbon dioxide capnography measures the amount of carbon dioxide coming out from the alveoli at the end of the respiration. And the normal value should be 35 to 45. If it is 35 to 45, it shows that the endotracheal tube is directly placed correctly in the airway. Okay, so end wave capnography is the best method, accurate method in order to assess the ET tube placement. Please remember this. It is a repeatedly asked question. Okay, and fifth question, which of the following condition leads to hyperphosphatemia? Very, very simple question. We doesn't expect this kind of questions in mains exams. See, hyperphosphatemia, in one hand hyperphosphatemia is there, means another hand hypocalcemia will be there, because both are inversely related to each other. If hypercalcemia will be there, means on the other hand hypophosphatemia will be there. Both are inversely related. Fine. Okay, so this inversely related, what I mentioned now, it will take you to the answer very easily. So here what they have mentioned, hyperphosphatemia. So what will happen to the calcium? Hypocalcemia. So in the condition like hyperphosphatemia, definitely patient will be having what? Hypocalcemia. Right? Clear with the concept? Right? Fine. So here the right answer is what? Option A. All the answers I have highlighted in the bold letters. Okay. And the rationale I have given here. And one more thing, mostly hypocalcemia commonly seen in two conditions. The first one is hypoparathyroidism. Hypoparathyroidism. And one more condition is that is renal failure. Okay. Fine. Next one. Question number 6. A patient is going to the operation theatre for abdominal surgery. Okay. And the nurse administers injection atropine sulfate. Surgery. The patient is going for surgery is the first key point. And the nurse is administering atropine. So you all know that atropine, the function is it reduces the secretion. It reduces the gastric secretion. It reduces the respiratory secretions. And it prevents the aspiration during the surgery. And also the second point is, see, if the patient is going for abdominal surgery or any kind of surgery, because of the anesthetic effect, the patient will go for bradycardia. So in order to prevent the bradycardia, in order to maintain the heart rate, the second mechanism of the atropine is maintaining the vitals, maintaining the heart rate. Okay, fine. So if you have this concept in your mind, definitely it will take you to the answer very easily. Okay, so once again I will read the question. A patient is going to the operation theatre for abdominal surgery and the nurse administered injection atropine sulfate. Okay, the patient attendant asked why this injection is given just before the procedure. This is the question. And here the right answer is going to be, see, it enhances the effect of anesthetic medication. Option A, no, eliminate the option A. And what about option B? It reduces the secretion of gastrointestinal secretion. Yes, obviously it is correct. It reduces the GI secretion as well as the respiratory secretion, right? So option B is correct. And C, it will prevent the anesthetic drug-induced bradycardia. This one is also correct. Option B, option C, both are correct. And let's see the option D. It will reduce the patient anxiety. No, it is not an anti-anxiety drug, right? So eliminate option A and option D. So what is left? Option B and C is left. That is secretion. It reduces the secretion. It prevents the anesthetic drug-induced bradycardia. Both are correct. But priority, which is most important, that is, it reduces the secretion of GI as well as respiratory secretion in order to prevent the aspiration. So option B is the right one. Clear? Right? So question number 7. Which of the following communicable disease causes the highest mortality in India? Highest mortality rate in India, direct question from the community. So 4 options they have given here: TB, dengue, malaria and HIV. And on the whole, the right answer is going to be option A, that is TB. See, TB is the big burden in the India. Okay, if you are comparing TB with the dengue, the mortality rate is very, very less. And malaria, it is totally controlled in India. And HIV, here also the mortality rate is very less because of antiretroviral therapy or antiretroviral treatment. So on the whole, which is left? TB. TB is a big burden in India even now also. So here the right answer is option A. The next question is option question number 8. Which of the following clinical manifestation is seen in the heat stroke except? It is an except question, but it is a repeated question. Okay. And there are 4 options given here. Elevated body temperature, that is more than 103 degree Fahrenheit or 39 degrees centigrade, right? Obviously, during the heat stroke, the body temperature will increase, right? So, first option is correct. Bounding plus pulse. See, during heat stroke, the sympathetic nervous system will get activated and bounding pulse will be there. Okay, so second option is also correct. Third one, confusion and altered mental status. Definitely altered mental status will be there. Patient will be having a coma, seizure, confusion, agitation. Okay, all these things will be present in the heat stroke. So option C is also correct. And which is left? Excessive sweating. Please keep in mind, guys, most of the students, they will not select excessive sweating for except question, because in each stroke most of the students think that sweating will be there. No, that is wrong. In heat stroke, sweating will not be there. Okay, because hot and dry skin will be there. Sweating mechanism is absent and in the what? Heat stroke. Clear? So it is except question. So which is the right answer here? Option D, that is except sweating. All other things will be present for the patient. So here the right answer is what? Option D, because of except question. Clear? The next one, a patient scheduled for lumbar puncture procedure. On duty nursing officer prepares the patient, place him in appropriate position. So the patient is going for lumbar puncture procedure. So the patient came to the procedure area and the nurse already given the position, appropriate position is already given, and she is maintaining the sterility also. Okay, fine. Which one of the following intervention is also the role of the nurse? Also, already position given, sterility is maintained. Also, what else is the procedure or intervention supposed to done by the nurse? This is the question. So here the right answer is option A, send sample to the lab. Send sample to the lab. Okay, but most of the students has given the answer of obtain informed consent. See, explaining and obtaining the informed consent is the procedure of the physician or the doctor, right? So we cannot go with option D. And to turn the position, already the position is given. So we can eliminate option C also. Option B, assess for allergy and reaction. Yes, obviously we will assess the allergy and reaction, but the main role of assessing the allergy and reaction is the doctor's function. That is the role of the doctor. Understand? Yes, obviously we will be checking, but the main person who is supposed to do that is the physician. Okay, so on the whole, which is left? Send sample to the lab. After the procedure, we have to send the sample to the lab. Correct, guys? Fine. So here the right one is what? Option A. See, the rationale, everything is given here. Whatever I am explaining, everything is mentioned here. So just pause the video and means understand the concept. Okay. Question number 10. The nurse is caring for a child receiving blood transfusion. Very easy, repeatedly asked question. The nurse is caring for a child receiving a blood transfusion. The child becomes flushed and wheezing. What should the nurse do first? It is an anaphylactic reaction, right? Once the infusion started, blood transfusion started, immediately allergic reaction is also started. So what the nurse has to do now? Stop the infusion, stop the transfusion, right? So it is a repeated question, simple question, guys. So it's a direct question also. Stop the infusion and inform to the physician. Okay, fine. The next one, question number 11. A 56-year-old patient with chronic kidney disease present with serum potassium of 6.8. 6.8 is very means huge level. What is the normal potassium level? 3.5 to 5.5 milli equals per liter, right? So here it is 6.8. It is highly elevated, and also the PT wave is present. So if the potassium level is highly elevated, the patient is prone for arrhythmias. So in this time, first we supposed to protect the heart. Right? We have to protect the heart. How you will protect the heart? Administer calcium gluconate. Okay. So in case of arrhythmia, because of potassium, elevated potassium, just go for the calcium gluconate injection. First protect the heart. Followed by that, you can eliminate or you can do the procedure for eliminating the potassium. First protect the heart and then do the procedure for reducing the potassium. Okay, what are the procedure you will do? Salbutamol, nebulization, you can administer polystyrene sulfonate. You can see here, administer sodium polystyrene sulfonate. Otherwise, it is also called as K binders. insulin with the dextrose. Okay, in 25% dextrose, they will be adding 8 units or 10 units of insulin and they will be giving, so that the potassium from the blood, it will be switching to the cells, switching inside the cells. Okay, so these are all the different methods. Even diuretics we can administer. So these are all the methods to reduce the potassium. Obviously, we're supposed to reduce the potassium, but the first priority thing is we have to protect the heart, followed by that reduce the potassium. Okay, so the right answer is administering what? Calcium gluconate. Option B is the right one. Next, a patient is prescribed 6 units of insulin. 6 units of insulin. Available insulin concentration is 100 units in 100 ml. 100 units in 100 ml means 1 ml contain 1 unit. 1 ml contain 1 unit. And what is the doctor's order? 6 unit of insulin has to be prescribed, has to be given for the patient. 6 unit of insulin is prescribed for the patient. And what we are having in the hand? 100 ml contain 100 units. It means 1 ml contain 1 unit. So 6 ml contains 6 units. So how much we supposed to administer? We supposed to administer 6 ml. Clearly I have given here available insulin 100 units in 100 ml. It means 1 unit in 1 ml. And doctor's order is 6 units. So we can take 6 ml. Right? 6 ml is equal to 6 unit, and then we can administer the patient. Right? Fine. Easy question. Question number 13. Patient is in Aspirant therapy. Okay. So usually if the patient is in Aspirant therapy, we are supposed to check for APTT value. Right? So what is the normal APTT value? 25 to 35 seconds. Usually it comes in second. 25 to 35 seconds is the normal APTT value. Okay. Fine. What is the expected nursing action? See, patient is in Aspirant therapy. APTT value is 85. 85 is very high. What is the normal APTT? I have mentioned here in the Rationale. Normal APTT is 25 to 35 seconds. If the patient is taking Aspirant, then it can go up to 70. 45 to 70 seconds is also acceptable. But here you can see 85. The patient is prone for bleeding, right? In this situation, what we are supposed to do? Reduce the Aspirant dosage, so that the APTT level will be reduced, right? So here the right answer is what? Option C, reduce the dose of the therapy. Reduce the dose of the therapy. If you know the normal value of APTT and therapeutic range of the APTT for the patient who is taking Aspirant, then you can solve this question easily. Okay. Next one. Again, repeatedly asked question, guys. Simple one-liner question. Which drug have bactericidal effect in TB? It is an except question. Okay, what is that? It is an except question. Which drug have bactericidal effect in TB? Okay, isoniazid, rifamycin, streptomycin, ethambutol. 4 options they have given here, and here the right answer is option D, because as you all know that 4 drugs it is doing bactericidal action, and 1 drug it is doing bacteriostatic action. Cidal means killing the bacteria. Static means only preventing the multiplication of the bacteria. So bacteriostatic action is done by the ethambutol, not bactericidal. But in the question, what they are asking which drug have bactericidal effect. Bactericidal means killing, but ethambutol is not killing, it preventing the multiplication of the bacteria. Understand? That's why it is an except question we have selected here. Option D. Okay. Next one. A patient having neuropathic pain. That is the key point. Neuropathic pain. What is the drug nurse can administer to settle down the pain? To reduce the pain, what drug the nurse has to administer? So the first key point, neuropathic pain. So to reduce the pain, what drug is the second key point? Drug, neuropathic pain. 2 key points they have mentioned here. Okay. So always remember, guys, 2 anti-epileptic drugs we are using for reducing the neuropathic pain. Mostly neuropathic pain, it is very, very common among the diabetic patients, because diabetes, see, as you all know that diabetes, see, one more additional information I would like to tell here. So everyone knows that 2 types of diabetes is there. Type 1 diabetes, type 2 diabetes. One more diabetes is also there, that is type 3 diabetes. Type 1, insulin dependent. Type 2, non-insulin dependent. Type 3, if the patient is having acute pancreatitis and self-destruction of the pancreatitis taken place, and because of the self-destruction of the pancreas, beta cells are damaged, that time it is considered as what? Type 3 diabetes. Clear, guys? Fine. See, in that case, nerves are getting damaged, blood vessels are getting damaged because of the damage of the blood. Sorry, because of the damage of the nerves, the patient will be getting what? Neuropathic pain. Patient will be getting neuropathic pain. So, usually, what is the drug of choice for neuropathic pain? Two drugs are there, which is commonly used for the neuropathic pain. Okay. So, two anti-epileptic drugs. The first one is gabapentin and second one is pregabalin. Gabapentin, pregabalin. Okay, these are all the two very commonly used drug for neuropathic pain. So here pregabalin option is not there, but gabapentin option is there. So the right answer is what? Option A. What about brufen and tramadol? These are all the drugs, analgesic drugs, which is used to reduce the pain caused because of the inflammation, trauma, inflammation. Okay, and dicyclomine is totally different. It is an antispasmodic drug. If there is any muscle cramps, abdominal cramps, that time we will be using what? Dicyclomine. Okay, guys. Next, question number 16. Which of the following food items contain highest protein per 100 gram? Highest protein, they are asking. In 100 grams, highest protein, they are asking. And they have given four options like egg, soya bean, mutton, groundnut. And as you all know, soya bean is having a rich source of protein. 100 gram of soya bean, it contains 36 gram of protein. Okay, fine. 100 gram of soya beans contain 36. It is a huge one. And second one is groundnut. Groundnut is also 100 gram of groundnut contain 26 gram of proteins. Egg 13 grams and mutton 25 grams. Okay, so on this four, which is the highest one, soya bean, 36 gram of protein is present in 100 gram of soya bean. So that's why here the right answer is what? For question number 6, option B is the right one. Question number 17, the patient receiving isoniazid, again related to isoniazid TB drugs. Patient receiving isoniazid and rifampin therapy or supplemented with which vitamin? Very important, repeatedly asked question. Okay. Isoniazid drug is taken by the patient. If the patient is taking isoniazid drug and rifampin, what vitamin supplement has to be given additionally? This is the question. Okay, especially you have to focus on isoniazid. In compared to rifampin, you have to focus on what? Isoniazid. Okay, so let's see what is there. See, isoniazid, the patient is taking. This isoniazid will interfere with the absorption of vitamin B6. Clearly, I have mentioned in the rationale. Isoniazid can cause peripheral neuropathy by interfering with the vitamin B6. What is the other name of vitamin B6? Pyridoxine. Clear? So, if the patient is taking isoniazid, definitely they have to take the additional supplement of vitamin B6. So, the right answer is option C, vitamin B6. Okay. Next, what is the use of bougie and an introducer in airway intubation procedure? First, you should know what is bougie. See, you can see a blue color instrument, what they are using here, holding here, that is called as bougie. See, it is used as an assistive device for intubating. During intubating with the ET tube, if there is any difficulty in intubation, that time we will be using the bougie. What type of difficulty in intubation? So the right answer here is when vocal cord is not at all visible. What is not visible? When the vocal cord is not at all visible, while inserting the endotracheal tube, if the vocal cord is not at all visible, obviously, while inserting the endotracheal tube, we will be using the laryngoscope. The laryngoscope is having a light and the visual will be good. But still, sometimes, after using the laryngoscope, also inserting the endotracheal tube, if it is getting difficult, that time the next option is by using the bougie. You can see this black color one is the bougie. They are inserted inside the endotracheal tube and then they are inserting inside the what? Vocal cord. Okay. So this is how it is acting as a assistive one. So when the vocal cord is not visible, that time we can go with the bougie. So here the right answer is what? Option B. Okay. And question number 19, a patient has a urine output. Very simple question, guys. Anuria, oliguria, polyuria. Related to this only this question is. Okay. A patient has a urine output of only 100 ml in 24 hours. 100 ml means immediately you would have got the answer. 100 ml in 24 hours. This condition is called as. Four options they have given here: oliguria, anuria, oligoanuria, and polyuria. So here, as you all know, 100 ml in 24 hours means definitely it is going to be option B, anuria. Okay, you can see the rational additional golden points are there. Normal urine output, are approximately 1500 to 2000 ml is the normal urine output. Oliguria means less than 400, and anuria means less than 100 per day, and polyuria means more than 2.5 to 3 liters per day. Everything is in day. Okay, so here in this question they are asking 100 ml in 24 hours, so directly it will take you to option B, that is anuria. The next one, after a gastrointestinal procedure, the patient is in jejunostomy tube feeding. That is the key point, jejunostomy tube feeding. Okay, that is the key point. Okay, see, jejunostomy tube is directly inserted inside the stomach, directly inserted from through the abdomen. For example, this is the abdomen, this is the umbilical cord. See, directly they will be inserting the jejunostomy tube in the stomach through the abdomen. Okay, fine. So which of the following action is appropriate? They have given four options they would have been given. So here I have only three options. Flush the tubing option. Give the feeding in the upright position. Upright means sitting, Fowler's position. Give the feed fast. Definitely fast. We will not give, eliminate the option. Give the feeding in upright position. Sometimes if the patient is not comfortable with upright position, we can go with the semi-Fowler's position also. It is not at all contraindicated. Okay. Flush the tube often. It is very, very important. That is the means the care which we supposed to give to the patient. If you are not flushing the feed tube often, there is a chance for getting block. So in order to avoid that, definitely we supposed to flush the tube often. So option A is the right one, and the rationale is clearly given here. Okay, for this 20th question, the rationale is option is right. Which one is the right answer? Option A. Okay, fine. So 20 question we have discussed today. And again, next 20 question we will be discussing in the another video. So thank you very much for watching the video. If you have any doubt anywhere, you can drop your message in the comment section. As I mentioned already, again, Metier Academy, it is starting the another exclusive NORCET-10 batch in Delhi second branch as well as in Puducherry. So whoever willing to join as early as possible, please get admitted in the class and clear the session, means NORCET exam, NORCET-10 exam in the first attempt. Thank you very much for watching the video, and please watch the video, and if you like the video, please like it, share it, and subscribe the channel, and please share this video to your friends also, so that everyone will get utilized from this video, benefits from this video. Okay, thank you very much, guys.